As people get older, their blood vessels can become clogged by a buildup of plaque and calcium. This can cause serious health problems.
It blocks blood flow to where it needs to go. So if your blood is flowing to your brain, then it can block blood flow to your brain and you can have a stroke. If you have decreased blood flow to the muscle of the heart itself, it can cause a heart attack or myocardial infarction. If you have decreased blood flow to the kidneys, it can cause decreased kidney function.
The problem is called Artherosclerosis, or more commonly, hardening of the arteries. Dr. Jagdeep Obhrai says prevention and treatments have improved substantially in recent decades.
Now we try to treat patients before they actually present with stroke or heart disease. We have advanced tools that allow us to detect hardening of the arteries or atherosclerosis before it causes clinical manifestations like stroke or heart disease.
Dr. Jagdeep says the causes of the condition are well understood.
The principal risk factors for hardening of the arteries are four. The first is use of tobacco, smoking. The second is diabetes. The third is high blood pressure. And the last is high cholesterol. So we try to control those four risk factors. We ask patients to stop smoking. We ask them to come in and get their blood pressure checked, get their cholesterol checked, and control their diabetes.
Okay, so it's a question of taking the medication that's prescribed to you to keep your blood pressure down, to control your cholesterol, or whatever the specific problem that's diagnosed. And I suppose also exercise and being in good shape is also a way to prevent this.
It's critical. Diet and exercise can control blood pressure, it can help control diabetes, and it can help control cholesterol. All of those things can really be affected by appropriate diet and exercise.
In recent years, techniques have been developed allowing doctors to mechanically force open a clogged blood vessel.
We insert wires into large blood vessels and then feed them to the blood vessels that lead to the brain, to the heart, or to the kidneys. And then once we do that, we're able to expand balloons, place metal expanders there that help the artery stay open. We try to do that as a last resort. We would much rather treat the problems before they have clinical manifestations.
The condition was less common decades ago when more people did strenuous labor.
These are some of the most common problems in developed countries, and they're becoming even greater problems in developing countries as developing countries gain exposure to increased meat and fat in their diets. They are actually living longer, but then there are actually accruing problems like atherosclerosis. So in developed countries, we've had this problem for many years. In developing countries, there are increasing problems.
With artherosclerosis a growing problem, education on how to prevent or control it is more important than ever. Hardening of the arteries is a major cause of heart attack and strokes in the developed countries and increasingly in the developing countries too. Experts say the best way to avoid this problem is to exercise and keep fit and to follow the dietary advice and any medications your doctor gives you. For Saudi Good Morning, this is Burton Bolag in Washington.